Bismillahirrahmanirrahim. Welcome to our presentation on handling emergencies related to cerebrovascular compromise in dental settings. Alteration in cerebral blood flow can be compromised in three principal ways. These include embolization of particulate matter from a distant site, formation of a thrombus in a cerebral vessel, and rupture of a vessel. Material that embolizes to the brain from a distant sites typically originates from the thrombi in the left side of the heart, the carotid artery, or bacterial vegetations on infected heart surfaces. Cerebrovascular thrombi generally forms in areas of atherosclerotic changes within cerebral vessels. Vascular rupture can occur due to rare congenital defects in the vessel such as Berry aneurysms or AV malformations. The effect on the level of consciousness due to a cerebrovascular problems depends on the severity of the cerebral lesion. If the problem resolves quickly, as seen with transient ischemic attacks, symptoms may last only a few seconds or minutes. TIA results in a temporary numbness, weakness on one side, and possible speech or visual disturbances without altering consciousness. However, severe ischemia may cause brain infarction, resulting in permanent neurologic deficit. Embolism starts with mild headache, progressing to vertigo, dizziness, and weakness in an extremity. In cerebral hemorrhage, there is an abrupt severe headache progressing to nausea, dizziness, vertigo, and sweating with the risk of unconsciousness. This box shows the signs and symptoms of cerebrovascular compromise in progress. In dental settings, if the TIA occurs, stop the procedure, reassure the patient, and refer them to a physician urgently. If non-transient symptoms occur, stop the procedure, monitor vital signs frequently, call for medical assistance, and prepare for possible hospital transport. Continuous vital signs monitoring and immediate medical assistance are crucial. Administer oxygen if the patient has respiratory difficulty, but it is otherwise contraindicated. Reversal of any administered narcotics is important. If the patient loses consciousness, monitor vital signs frequently and initiate BLS if required. This box shows the management of cerebrovascular compromise in progress. To conclude, understanding the mechanisms, embolization, thrombosis, and vascular rupture is essential for identifying cerebrovascular compromise. If any symptoms of cerebrovascular issues are detected during dental procedure, it is crucial to stop immediately and reassure the patient. Quick referral to physician and emergency management can significantly impact patient's outcome. Patient safety is the most important thing. We need to keep a close watch and be ready to take action, like giving oxygen, reversing narcotics, and starting basic life support if necessary. Thank you. Wish you best of luck.